If you live in North Carolina, you live in the stroke belt, an area of the country with an unusually high number of strokes. And even more concerning, Eastern North Carolina has the highest stroke death rate in the nation. In fact, there's been one stroke death every 2 hours over the last 30 years in our state.
But if we educate ourselves and others, we can change this.
Would you know if you or a loved one was experiencing a stroke?
Well, I didn't know that I was having a stroke. Even being a healthcare professional, I didn't recognize the symptoms.
82% of adults in North Carolina would not recognize all 5 symptoms of a stroke and call 911.
Here are the 5 warning signs of stroke.
Sudden numbness or weakness of the face, arm, or leg.
Sudden confusion and trouble speaking.
Sudden trouble with vision.
Sudden trouble walking, dizziness, loss of balance, or coordination.
Sudden and severe headaches with no known cause.
If you have a sudden loss of vision, a sudden trouble speaking, a sudden headache, things like that that happen quickly, take heed to those warning signs.
Do not delay. Call 911 right away. Do not wait to see if your vision will improve or your headache will go away.
Stroke is a sudden loss of brain function caused by the sudden blockage of blood flow to the brain. A stroke can be minor at onset and develop into a large stroke if not treated. We now have medication that helps treat strokes that are happening. The medication, called TPA, is a medication that dissolves clots. It will dissolve a clot that is in the artery going to the brain, and if you get to the emergency room for this medication within 3 hours of onset of symptoms, that stroke may stop and symptoms may reverse. So it is very important you note the onset of symptoms for the doctor in the emergency room and call 911 to get immediate medical attention. If you are unfortunate enough to have a stroke and you are left with some disability, early rehabilitation is important. We do have outpatient and inpatient rehabilitation at Nash, and we are fortunate to have the Bryant T. Aldridge Rehab Center for inpatient rehabilitation.
Here are a few things you can do to help prevent a stroke. Watch your blood pressure. If you have diabetes, manage it according to your doctor's instructions. Quit smoking. Watch your weight. Exercise after consulting with your physician. Every stroke is serious, and reaction time might be the difference between life and death. When patients survive, response time can have a great impact on their level of recovery.
We have the opportunity to make a difference. Let's commit ourselves to learning the symptoms of stroke, teach them to others, and call 911 right away if we see them. Here at the Rehabilitation Center, we also offer a support group, which is an important process that happens after someone leaves the rehab center. You can come back and meet with other stroke survivors and caregivers and talk about your experience once you're discharged home and the challenges that you face. And it's a place to get support and answers and be able to verbalize your feelings about recovery.
To learn more about stroke and to help teach others, visit www.nhcs.org.